Hi there, I'm Ivana and I'm a psychologist living and working in Luxembourg. I would like to change course on Mind Matters now and make a small diversion with covering types of therapies that are rooted in sound science. These can serve as a guide for your pursuit of mental health well-being in the future. The landscape of psychological treatment has been profoundly shaped by behavioral and cognitive therapies, representing some of the most empirically validated approaches to mental health intervention. These methodologies have revolutionized our understanding of how to create lasting positive change in human behavior and thought patterns. Behavior therapy emerged from rigorous scientific principles, particularly learning theory and the pioneering work of Ivan Pavlov in classical conditioning. This foundation was further developed by Joseph Wolpe, who demonstrated how learning principles could be applied to treat anxiety disorders. The appeal of behavior therapy lies in its focus on observable phenomena, making it particularly attractive to those who value empirical evidence in psychological treatment. The behavioral approach encompasses a rich array of techniques, each designed to either enhance desired behaviors or reduce problematic ones. Systematic desensitization, a cornerstone of behavioral intervention, combines relaxation techniques with graduated exposure to anxiety-producing stimuli. For example, someone with agoraphobia might begin by simply imagining leaving their house, then progress to standing in their doorway, and eventually work up to taking short walks in their neighborhood, all while maintaining a relaxed state. Flooding represents a more intensive behavioral intervention where clients are exposed to their fears in a controlled but concentrated manner. While this approach can be challenging, it often produces rapid results when properly implemented. Consider someone with a fear of public speaking. They might be asked to give multiple presentations in a single session, discovering through repeated exposure that their anxiety naturally diminishes over time. Token economies provide a structured framework for reinforcing positive behaviors, particularly effective in institutional settings or with younger clients. This system involves earning tokens for desired behaviors, which can later be exchanged for meaningful rewards. For instance, in a residential treatment facility, patients might earn tokens for participating in group therapy, maintaining personal hygiene, or completing daily tasks, which they can then exchange for privileges or desired items. Contingency contracting introduces a formal element to behavior modification, establishing clear agreements between therapist and client regarding behavioral goals and consequences. These contracts might specify, for example, that an adolescent will earn increased computer time for completing homework assignments, with specific reductions in privileges for non-compliance. Satiation techniques involve repeated exposure to a behavior until it becomes less appealing, while response cost procedures focus on removing reinforcers as a consequence for undesirable behaviors. These techniques must be applied carefully, with full consideration of potential ethical implications and unintended consequences. The field's evolution continued with the development of cognitive therapy, which addressed some of the limitations of purely behavioral approaches. Albert Ellis's contribution through rational emotive therapy, RET, highlighted the crucial role of belief systems in emotional responses. Ellis identified common irrational beliefs that contribute to psychological distress, such as the belief that one must be universally loved and approved of, or that past experiences inevitably determine future outcomes. Aaron Beck's work in cognitive therapy, particularly his approach to treating depression, provided a structured framework for understanding how negative thought patterns maintain emotional distress. His concept of the cognitive triad, negative views of self, world, and future, helps explain the self-perpetuating nature of depression and offers clear targets for therapeutic intervention. For instance, a depressed individual might believe they are fundamentally worthless, negative self-view, that others are constantly judging them, negative worldview, and that their situation will never improve, negative future view. Cognitive behavioral therapy, CBT, represents the integration of behavioral and cognitive approaches, acknowledging that thoughts, emotions, and behaviors form an interconnected system. CBT practitioners help clients identify and challenge distorted thinking patterns while simultaneously working to modify problematic behaviors. This might involve maintaining thought records to track negative automatic thoughts, conducting behavioral experiments to test assumptions, and developing new coping strategies. Common cognitive distortions addressed in therapy include catastrophizing, assuming the worst possible outcome in any situation, all or nothing thinking, viewing situations in extreme terms without acknowledging middle ground, overgeneralization, drawing broad conclusions from limited evidence or single experiences, emotional reasoning, assuming feelings accurately reflect reality, mental filtering, focusing exclusively on negative aspects while ignoring positive elements, labeling, applying rigid, often negative labels to oneself or others, should statements, holding oneself to rigid rules about how things should be, personalization, taking excessive responsibility for external events, jumping to conclusions, making negative interpretations without supporting evidence, magnification/minimization, exaggerating negatives while downplaying positives. The structured nature of CBT sessions typically includes review of homework assignments from previous sessions, setting an agenda for the current session, working through specific problems or skills, identifying and challenging cognitive distortions, developing and practicing new coping strategies, assigning new homework for practice between sessions, measuring progress through objective assessments, planning for relapse prevention. Behavioral experiments play a crucial role in CBT, allowing clients to test their beliefs against reality. For example, a person with social anxiety might predict complete rejection if they make a minor social mistake. Through carefully designed experiments, they can discover that such mistakes rarely lead to the catastrophic outcomes they fear, and that most people are far more focused on their own behavior than on judging others. The ethical considerations in behavioral interventions deserve special attention, particularly regarding the use of punishment procedures. While punishment can effectively suppress unwanted behaviors, it may have unintended negative consequences such as emotional side effects, including anxiety, depression, and aggression. Temporary rather than permanent behavior change, modeling of punitive behavior, damage to the therapeutic relationship, potential for abuse or misuse, development of avoidance behaviors, interference with learning new positive behaviors. Therefore, modern behavior therapy emphasizes positive reinforcement strategies whenever possible, using punishment only as a last resort and with careful consideration of potential impacts. This approach aligns with ethical principles of beneficence and non-maleficence, ensuring that interventions promote positive change while minimizing potential harm. The effectiveness of these therapeutic approaches has been extensively documented across a wide range of psychological conditions, including anxiety disorders, including specific phobias, social anxiety, and generalized anxiety, depression and mood disorders, obsessive-compulsive disorder, eating disorders, substance use disorders, post-traumatic stress disorder, personality disorders, relationship difficulties, anger management issues. Other recent developments in these fields include integration with mindfulness practices and acceptance-based approaches, adaptation for online delivery platforms and teletherapy, development of specialized protocols for specific conditions, enhancement through virtual reality technology, integration with neuroscience findings. The success of behavioral and cognitive approaches lies in their empirical foundation, structured methodology, and focus on measurable outcomes. By combining elements from both traditions, therapists can create comprehensive treatment plans that address both observable behaviors and underlying thought patterns. This flexibility allows for individualized treatment approaches while maintaining the scientific rigor that characterizes these therapeutic traditions. The ongoing evolution of these therapeutic approaches continues to enhance their effectiveness and applicability. As our understanding of human psychology deepens and new technologies emerge, these foundational approaches adapt and improve, maintaining their relevance in contemporary mental health treatment. Their emphasis on measurable outcomes and evidence-based interventions ensures they will remain central to psychological treatment well into the future, while their flexibility allows for integration with new discoveries and methodologies as they emerge. I hope that this narrative episode on CBT will help you decide if this approach is for you. In the next episode, I will tell you more about humanistic therapy approach, and of course, always check with a certified psychologist or psychotherapist before starting a new therapy or protocol. I will link all the studies and references in the show's description. If you found this discussion insightful, please consider sharing it with friends, family, or colleagues. Let's keep the conversation going about how we can make this affluent corner of Europe a healthier, more equitable place for everyone. Until next time, remember, your mind matters, and taking care of it is the best investment you'll ever make.